So when someone gets sick with Ebola, within a couple of days they start to have a fever and maybe a headache, lots of body pains, and within a few more days after that, that's when they start having the vomiting, the diarrhea, and maybe bleeding. At that time, the family is seeing that, and it's very scary for a family to see a loved one in such great pain, and also with the vomiting and the bleeding. If that person gets to an isolation center for treatment, then they're separated from their family. Their family can't be with them, and they can't sit there with them. They can't comfort them. They can't hold their hand while they're sick. And I think that's incredibly difficult for families to not be able to be there and be present. And then if that loved one dies, I can't imagine that loss. But then also, if that loved one lives, there's still that stigma that goes with them having been sick. People are afraid of them. People don't necessarily want them to come home. And I think that's difficult for both the family and the person who has been ill. There's also children whose parents have died from Ebola, and those children don't have anywhere to go because people see them as being victims of Ebola, and they don't want to take them into their homes, again, because they're scared. They don't understand what is this illness, what has caused this. So I think that it's not just a health issue, but it's a social issue, and it's emotionally, I think it's very difficult for these communities. It's incredibly important that the humanitarian community respond to this Ebola outbreak. The health system locally is completely overwhelmed, and without our assistance, the outbreak can spread across other countries. We've already seen it spread into Europe and a few other places. So it's incredibly important that we're able to isolate the cases, to control the outbreak, and to be able to save thousands of lives in the process. I think anyone who's going to respond to the Ebola outbreak has had a conversation with themselves, you know, what happens if, or what happens if I do get sick and I'm there. I think it's a consideration, and I think it's a risk that you have to be aware of if you're going to go, because there are health workers who have gotten sick. There are people who are just in the country who have gotten sick. And for me, I think the risk is even greater to do nothing. The risk of it spreading into other countries, of thousands more people dying, that to me is a risk that I'm very much willing to take if I can help to prevent that spread. I think a lot of people are asking and wanting to know, what can I do to help? Not everyone is able to go to these countries and try to provide support or medical care. But even just your prayers and your gifts, your generous donations to organizations like Medair and other organizations who are trying our best to combat this illness, your gift can make a huge difference and enables us to be able to save lives and to move quickly in order to isolate these cases and to control the outbreak.